Hello and welcome. Let's identify polycythemias based on their characteristic. So sit back, relax, listen, and learn. First is relative polycythemia, which is because of a decrease in the plasma volume. Circulating plasma volume is reduced, so it is relative polycythemia. RBC mass, O2 saturation, and EPO concentration all remains normal. It's just that the plasma volume is low. You are dehydrated, you have burns, which causes decrease in the plasma volume. Everything else, RBC mass, O2 saturation, and EPO remains normal. Relative polycythemia. Okay. Next is polycythemia vera. Now here there is a mutation in the genus kinase 2, which results in neoplastic proliferation of hematopoietic progenitor cells. So you have increase in the RBC mass, you have increase in the plasma volume, you have hyperviscosity, and the negative feedback of your body is decrease EPO production because you have so much RBC mass, so much plasma volume, and so much hyperviscosity. So the EPO goes down in polycythemia vera. O2 saturation remains normal. Polycythemia vera has a slight male preponderance, okay? And thrombosis is a complication of polycythemia vera. So to manage polycythemia vera, we would do phlebotomy to reduce the hyperviscosity and the red cell mass. You would give aspirin to prevent the risk of thrombosis. And if the patient has aquagenic pruritus, where after a hot bath there is itching, aquagenic pruritus, then you manage it with antihistamines or SSRIs like doxepin. Antihistamines or SSRIs like doxepin. Now, ruloxitinib, hydroxyurea, or pegylated interferon are used if the pruritus is resistant. Ruxolitinib, ruxolitinib, pegylated interferon, and hydroxyurea are used if the pruritus is resistant. Next is apoproducing tumors. So, paraneoplastic syndrome, apoproducing tumors. So this would be your RCC, HCC, renal cell carcinoma, hepatocellular carcinoma, cerebellar hemangioblastoma. These tumors produce EPO. So EPO is high, and because EPO is high, RBC mass is high, but plasma volume and O2 saturation remains normal. Okay, so EPO is high because it is an EPO producing tumor, renal cell carcinoma, hepatocellular carcinoma, cerebellar hemangioblastoma. EPO goes up, RBC goes up, RBC mass goes up, but plasma volume and O2 saturation remains normal. Okay, then you have hypoxia, high altitude, hypoxia, high altitude. So here you would have increase in EPO and you would have a increase in the RBC mass, and in hypoxia of course the O2 saturation will be low. Okay, this is compensatory because your body thinks or has actual hypoxia, so they are increasing EPO in response to the decrease in the O2 saturation. Okay, so whether lung disease, high altitude, or a heart disease, any of these reasons are causing a decrease in the O2 saturation. So EPO goes up, RBC mass goes up, but the plasma volume remains normal. Okay, thank you for watching.